Welcome to Health Diary. My name is Winnie Lubembe and we're coming to you from 4 Points by Sheraton right here in Hurlingham. Now, according to the World Health Organization, over 150 million new cases of bronchitis occur every year, and of this, 13% are severe and require hospitalization. So what exactly is it about bronchitis? Who is more at risk? And what do you need to do in the event that you suspect you have bronchitis? Well, we'll find out after this fact of the matter. Bronchitis occurs when the bronchioles, that is, air-carrying tubes in the lungs, are inflamed and make too much mucus. There are two basic types of bronchitis, chronic and acute. While acute bronchitis clears up by itself, there is no cure for chronic bronchitis, but there are several medications to help relieve symptoms. Right, so bronchitis, not a new term, but still not very well understood. And of course, that is why we're here today, to just help you understand what bronchitis is all about and what you need to know, especially when it comes to the signs and symptoms and what to do in the event that you suspect that you could be having bronchitis. And of course, to help us with that conversation, we have Dr. Kevin Nguringa, who is a physician. It's very good to see you, Dr. Thank you very much for making time for us.
Thank you for having me on the show.
All right, and of course we also have Iwan Nyaga, who again has lived with bronchitis, and she is here to share her story and her experience as well with us, so that you get a better understanding of what bronchitis is all about. So Iwan, again, thank you very much for coming by today. Karibu sana. All right, and Dr. before we even talk about bronchitis, let's just get to understand the lungs, right? What does it look like? What are the functions and some of the, the different parts that make up the lungs?
The main function of the lung is actually to help in exchange of oxygen, which is a very important component for all the basic living cells of a human being. So there are two sets of lungs. Then there are the vessels, or what I would call the pipes that transmit air up to the level of the alveoli. The alveoli is the small pockets that are involved in exchange of oxygen from the lungs to the blood. So the airway keeps growing smaller as you go down up to the level of the bronchial, and as such you can have complications along the whole tract. Okay.
Yeah. All right, so that is where then the infection, either the infection comes in or where the problem is, at the bronchi or the entire lung. Where exactly does bronchitis affect?
Bronch means the airway, and then itis is inflammation. So it's inflammation of the airway. So or the airway can be inflamed all the way from the nose up to the level of the lower respiratory tract system. But in bronchitis in specific, it involves medium-sized airways up to the small airways.
All right. Yeah. And then when we talk about the different types, do we have like several types when it comes to bronchitis?
Oh, there's several types of bronchitis, but basically you would start with whether it's acute bronchitis or chronic bronchitis, because that's the biggest chunk of patients fall within that. There are others that are associated with inflammation and what we would call eosinophilic bronchitis. People who are just prone to allergic reactions, and that would have eosinophilic bronchitis. There's plastic bronchitis.
And of course, Iwan, let's talk to you. You were telling me you knew about bronchitis at around age 7, thereabout. Yeah. What happened? Is it that you contracted it at age 7, or did it, begin before?
I'm not sure if it began before, but that is the time I came to know of the knowledge about it, because of the constant coughs, prolonged even after medication. And it was becoming bothersome because, you are struggling to breathe. It's like you feel it's not flowing, you are using a lot of energy to breathe. Yeah. So that's when I came to know about it.
Okay.
Yeah.
So, and of course at age 7, pretty young.
Yeah, I was in primary school.
Active,
yes. Yeah. So you can't play with the others because your parents, they are not comfortable with you being out there. At the moment we thought it's just an infection, but now as we grew up, because it became recurrent very often, that's when we knew it's bronchitis after we sought medical
attention.
Yeah.
Okay, so you said you were coughing a lot.
You cough a lot. There is struggle breathing. Most of the times you just feel tired. You are fatigued. You have not done anything, but you just feel your body, you don't have the energy.
Yeah.
Then sometimes, okay, for me, mostly it came after a flu, a very prolonged flu, then I knew something is coming. So then the cough comes and it persists for a while.
All right, and Dr. I'm looking at this, symptoms that she's talking about. They seem like any other symptom for so many other diseases. So do you feel it's very difficult for someone to pick and say this is bronchitis?
The most common symptom is a cough. It might, in acute bronchitis, it might be productive or non-productive of sputum. There's then shortness of breath, what she's describing as lacking, feeling like there's no air present for her. And then there's a wheeze, there's fever. So most of these are actually what now, if it's present for a very long time, it becomes chronic bronchitis, and the definition is different. Chronic bronchitis is where you have a cough that is productive of sputum, either colored or not colored, for 3 months or more than 3 months for at least 2 years, and that becomes chronic bronchitis.
Okay, all right. And you see, when you also talk about bronchitis and some of the symptoms, I'm looking at a case of pneumonia, right? Is there any similarity or any difference between the two? Because it's very easy to confuse the two.
Bronchitis itself is it can be an upper or lower respiratory tract infection. Pneumonia most of the time is a lower respiratory tract infection. It resolves with time, and most of the time it's would need antibiotics. For acute bronchitis, 90% of the time it's a viral infection. And most of this viral infection basically clear up on their own. So sometimes just by symptomatology, it's very difficult to differentiate between a pneumonia and an acute bronchitis.
The biggest question is then, what exactly causes it, or is the type dependent on the cause?
90% of bronchitis is viral infection, and so most of it will just clear up on its own. It's very important to know about the risk factors that would make you probably be prone to getting this viral infection, and one of the greatest risk factors is cigarette smoking. There's what we call occupational bronchitis, people who are rearing livestock, people who work in the textile industry. Right now, air pollution is a very big contributor to acute bronchitis, especially when you go to the sides of Athi River, where there's a lot of industries that deal with mining, coal mining. In our setup, especially in rural areas, we're talking about the biomass fuel that you're using, the charcoal, the firewood that you use. So these are just some of the risk factors that would make you more prone into getting acute bronchitis. Yeah.
What exactly happens that then leads up to a case of bronchitis? Is it they cause blockage, or is it they cause the inflammation, or what exactly happens that you as a physician would rule out pneumonia or the normal cough and arrive at bronchitis?
For acute bronchitis, it would last up to a month. It's sometimes non-productive. Initially, though, say that if you do an investigation, for example, you're looking for pneumonia, you'll probably see on the lung fields for chest X-ray, you'll see white out, and then you probably know this is pneumonia that would require antibiotic treatment. What is really important in acute bronchitis, there's no treatment for it. Most of it is just treating the fever, giving paracetamol, adequate rest, rehydration, and nothing more.
And so, again, how long did this last, before you sought medical attention, to just get to understand why is this cough not going away?
It lasted for a while, I think for on-off an year, because it will come, then 1 month off, next month you start the cycle again, then off. So that's when I sought the medical attention.
So school, how was school affected by the fact that you had bronchitis?
Yeah, school was affected sometimes, because sometimes, especially in high school, where people tend to think you are looking for an excuse not to do the chores or go to school or do something. sometimes it had to go to the extremes where now you can't breathe now, or you are coughing, the sputum has blood. Now that's when they'll start, hey, this is serious, she's not pretending.
Okay.
Now that's when you'll be taken to hospital and do stuff like that. Then now you'll be considered as a special case for some of the activities, like the running, the marathons, you know, yeah.
Okay.
Such
But
stuff.
how bad did it get?
I don't know if it's I'm weak. It used to get bad, and mostly at night. I don't know why. Like the breathing is becoming labored. You're struggling until sometimes you have to get aid to breathe. But okay, it doesn't, for that one doesn't last long. Maybe for the night, then you are released, then you come back with the cough.
Okay.
The labored breathing is just for a while.
Okay. All right, Dr. Why is that? You know, she talked about an aspect of labored breathing, especially at night.
Remember, we are talking about airways, and the way I like to look at it is like having a pipe. And if you're having mud sludging the pipe, then the amount of water that will eventually get to your tap is smaller. So the same way, if you look at your airways as being that pipe, and then there is hypersecretion of mucus, which happens in bronchitis. So it means the amount of air that is eventually going to get to the small pockets that we were talking about, which are the alveoli, and which then become responsible, because at the alveoli, they are capillaries of what blood will suck out the oxygen out of the alveoli. So the amount of oxygen reaching that effective area is reduced, and therefore the symptoms she's describing becomes apparent. So you have that labored breathing because you have less oxygen getting to your body.
Into the body. Let's talk about the people who are more at risk of developing bronchitis. Like you said earlier on, cigarette smoking is, you know, this is a group of people who are more at risk. But other than that,
10% of people who get bronchitis are young children. In our environment, then the greatest risk factor would be air pollution. Then back in our villages would be the biomass fuel that you're using, charcoal, firewood, things that would be pollutant, because remember you're breathing these pollutants, and these irritants then become a problem to your airway. So the way then you start a process of inflammation. So that's why air pollution and smoking are very, and even where you work, again, as I talked about occupational bronchitis, those are the greatest risk factors for developing them.
Okay.
Yeah.
So then what triggers the you know, bronchitis itself moving from acute to chronic?
Really, there's no science that describes why acute bronchitis would lead to chronic bronchitis. But basically, the triggers would say, if you were young and you had acute bronchitis and it resolved, then probably in your adulthood, then you started exposing yourself to some of these irritants, then your chances of having progression to chronic bronchitis is higher as compared to someone who didn't have acute bronchitis and then started having these irritants later on in life.
Okay.
Yeah.
All right. So, of course, let's take a short break. But when we come back, we'd want to understand, especially for one, you talked about an aspect of, yes, we went, sought medical attention. So we just want to understand, did that help? Or, you know, even as you grew up, did you still struggle with, you know, a case of bronchitis? But Dr. for you as well would want to understand, is it contagious? Because I think that is the biggest question that people ask. Is bronchitis contagious? And if so, what are some of the ways to, you know, to reduce the spread of the same? But of course, all that is coming up after the short break. Stay with us. This is Health Diary. All right, welcome back. Glad you're still with us. The show is Health Diary, and just in case you're tuning in right now, today our focus is on bronchitis. And like we said when we started the show, most of the time we hear about this, you know, term that is bronchitis, but we really don't understand, especially when it comes to the magnitude of the same. And we talked about an aspect of it can be acute or it can be chronic. You know, Dr. the biggest question that we just want to understand is bronchitis contagious?
Bronchitis is it's a respiratory tract infection, and as we saw in COVID, it has similar way of spread, which is respiratory. So if you cough and sneeze, if you have droplets on your hands and you greet someone, if you kiss, in terms of that, then that it's a contagious way of spreading the bronchitis. But what you're spreading really is not bronchitis. It's a viral infection that you're spreading that now turns out to be an acute form of bronchitis, which can later on become chronic.
Okay.
Yeah.
All right. So when it comes to then diagnosis of the same. What does it look like?
When you told about the symptoms, the presentation, a cough that does not go away despite your fever having resolved. The symptoms that are lasting for a very long time, you have a cough that lasts for 3 months or more than 3 months, that produces a sputum. It may be colored yellow in color, has streaks of blood in it. You have shortness of breath. If even walking for a short distance, you start losing your breath. You have this wheeze. And then difficulty in activities every other day, because then you need to understand chronic bronchitis forms a spectrum of diseases that are called chronic obstructive pulmonary diseases, and with them there are restrictive lung diseases and there are obstructive lung diseases. Obstructive means that you're obstructing the flow of oxygen into the lung. Restrictive means that the space is there, but you're restricting the flow of oxygen into the. So they form part of that spectrum because asthma, chronic bronchitis, some of the diseases that lead to chronic obstructive pulmonary diseases. And that's why chronic bronchitis is really something worrisome, and that's actually what brings the majority of people or patients to the hospital.
Okay.
Yeah.
And then very quickly, before you go back to A1, you said sometimes there could be a difference in terms of the color of the sputum. What does this say?
The blood streak is actually very easy to explain because you're having this pressure within your respiratory system. So you're straining again the vessels I was talking about, and they burst. And so that's what you find as a blood streak within your sputum. The color sometimes, most of the times it's yellow in nature. It's just a chronicity because remember you're unable, the normal mechanism of the body initially is to try and push out as much sputum to create room for air to enter the lungs. So with time, the body is unable to meet these demands of because the secretion is too much. So what happens is it gets reinfected or infected within those air spaces, and that's what now leads to exacerbations of bronchitis. So you have an acute on chronic bronchitis.
All right. So, and one, of course, for you, those an aspect of blood streak in the sputum, right?
Yeah.
Went to the hospital. What exactly were you told? What was the diagnosis process for you?
Okay, by the time I was getting to that sputum with blood, I already knew I have a pre-existing condition in bronchitis. I had to tell the examining doctor because that was not my doctor at that moment, and then he had to run more tests.
This is.
I'm in high school, so I'm thinking around 14.
All right.
Yeah, so you have to tell them, then they'll carry out now the tests to confirm. I already knew.
You knew that it was chronic bronchitis.
So it's just alleviating the symptoms once in a while when they go to the extreme. Does not really heal. Even the medication will still prolong. It like goes when it wants on its own.
Right.
The fever, but the cough will still be there.
Okay.
Yeah.
So is it continuous cough, or is it's more of on and off? When you're on medication, you feel much better?
It comes, it goes.
Okay.
Yeah, so you cannot say I'll take medication to prevent myself from getting those symptoms or something. Maybe now when it comes, now you try to cure the headache or the flu, you minimize the fever.
Okay.
Yeah, but it will still be there until it goes on its own.
In chronic bronchitis, basically, first when you get, it's as she's saying, it's a lifelong condition. And since it's a lifelong condition, you want to first be able to deal with exacerbations or these acute episodes that might happen on already existing chronic bronchitis. And some of the important aspect in management is basically having like a flu vaccine every year, and there are different types of flu vaccine. You can have the influenza vaccine, you need to do a pneumococcal vaccine. What this does is that you reduce your chances of getting an infection, and if you reduce your chances of getting an infection, then you reduce your chances of getting an exacerbation of the same. There's pulmonary rehabilitative therapy, which means you do there are 3 types of the different exercises. Yoga exercise is nice. There's exercises to strengthen your respiratory muscles. There are also exercises that would help strengthen your ability to be able to take in more oxygen. But remember also, when you're doing pulmonary rehabilitative exercises, they need to be gradual, because if you start exercises at a very rapid rate, then you go back to the same place you are, which is shortness of breath again, wheeze, because you already have a compromised pulmonary system.
All right, so this went on and off.
Yeah, this went on and off until I matured up. Then about 2 years ago, that's when I decided, it's not going away. At least let me try the flu vaccine so that I don't have the flu most of the time. I just have the cough. I deal with the cough. I think after I started getting that flu vaccine, I don't know if it helped or I outgrew the disease. Now it minimized. I think for the past 2 years, it has not occurred.
All right, Dr. And you mentioned a little bit about the treatment, but again, what influences what type of treatment one gets? Because, like we said, this is chronic. You have to deal to live with it.
One of the most important components is also involving the family, because they have to be able to deal with this socially, economically, and also the stresses that come with having a chronic illness. Also, why it's important to have treatment really is because you want to prevent the progression of disease, and especially the inflammation that is within the airways. So there is inhalers that are used that would help try and modulate the immune system and modulate the inflammatory process that happens within the pulmonary vasculature. The other aspect of management now, it's individualized form of management, because when you talk about pulmonary rehabilitative therapy, the exercises will depend on how far your disease has progressed. For example, if you're able to withstand normal exercises, you can do football, you can do soccer. There are people who are now almost at the spectrum where doing such activities is almost impossible, so you need to use a chest physiotherapist. And why chest physiotherapy is really nice, you want to try and push out as much mucus out of the respiratory tract as possible, because it becomes a focus of infection.
Okay. All right, so as we finish, one, of course, having again lived with bronchitis, you know how bad it can get, and especially if proper management is not done. What would you say to the people? And then number two, in terms of the costs.
Stop judging people who keep on coughing every time. It's not tuberculosis. Most of the people tell you are sick, it's tuberculosis, it's chronic. It doesn't have to be tuberculosis. Now, since it's a recurring condition, if you opt to use cash, you're going to spend a lot of money, because it's like you'll be in the hospital for almost every month or two. So yeah, the medical insurances, whatever you choose to use, it's more economic. Yeah. Then don't push yourself. At times you want to push yourself beyond. You don't want to do something, you're struggling, but you don't want the people around you to say you are lazy or something. You can't take part in activities. Just let it go. Do what you want, what your body allows you to at the moment.
Okay.
Yeah, because I realized if I push myself harder, when it comes back, it's stronger and worse. Like if I'm taking part in an activity and I feel it's training and I still push, when I go home, it will be more intense.
Yes,
yeah.
Okay, Dr. For you, what would be your clarion call? Because she says being in the hospital like almost every month, it's very costly, right? Yeah. What would be your clarion call to either insurance or just people really in general, and the government, if the government can come in as well?
First, what you're actually doing is a step in the right direction. Informing a society is really important, because it empowers them to know what to do. The other thing is, of course, through the National Health Insurance Fund, NHIF should include some of these diseases that are, I would call them neglected diseases, yet they are very prevalent within our society, within their comprehensive care packages, because then it's really expensive to have a disease that is lifelong and that would require lifelong treatment. And especially at the core end, we have patients who then go to long-term oxygen therapy, and just getting that long-term oxygen therapy is very expensive. I think you should have seen this during the COVID era, when just getting oxygen was a problem. To society in general is that when you have any form of cough that is lasting for very long, it would be very important and prudent to head to your nearest health facility or visit someone who has the ability to diagnose disease correctly, because the word here is correct, because if you do not diagnose it correctly, then you'll end up having a chronic disease that is very hard to treat, and then the cost and burden of society becomes higher. The other thing is that in general, the society, we need to embrace not only the normal vaccines that we've been used to, we now need to add to the vaccine that we have already been taking. To flu vaccines are really nice now with the COVID vaccine, the pneumococcal vaccine, which are not essentially included in the Kenya vaccine initiatives.
Yeah. All right, and of course, very, very important point over there, especially when it comes to vaccination, including that into the immunization schedule. Thank you very much, Dr. Kevin Guringa, physician, Ewan Nyaga, of course, live with bronchitis, here to share your story as well. We say thank you to both of you for coming by today, and of course, just helping us understand bronchitis. And on that note, take a look at this health tip.
If you have HIV, you need a lot more vitamin C. Now, yes, it's true, vitamin C is in fruits, it's in oranges, and so on. It's good. Moringa also is a good plant for vitamin C. Strawberries are fantastically high. Greens like broccoli is very high. All these foods are good. Vitamin C is important. Zinc is important. Zinc is a mineral that boosts the immune system. It's in seeds. So eating seeds is a very important way to boost the immune system. Selenium is a mineral that also boosts the immune system. And selenium is in anything that begins with SE. It's in seafood, it's in seaweed, it's in sim seeds, sesame seeds. So again, seeds, nuts, seafood, all of these help to boost the immune system.
Support instead of stigma and discrimination. That is the message that we get from today's episode that is on bronchitis right here on Health Diary. Support the ones who are struggling with bronchitis, and that will help them as far as managing the chronic condition, especially those ones who have chronic bronchitis. Well, that is where we put a stop right here on Health Diary on the conversation. And if you have any other question, feel free to interact with us on our social media platforms. My name is Winnie Lubembe. A special thanks to 4 Points by Sheraton for hosting us. Until next time, adios.